I want to do a little refresh of 3 supplements that are important for bone health. And this is because I think that bone health is very underrated. As an athlete or an active individual, having strong bones and having a strong foundation is going to make sure that you can build muscle, that you can support that muscle, that you can recover, that you're going to prevent yourself from injury, and that you can perform every day at the level that you would like to. So having enough calcium, magnesium, and vitamin D is very important for making sure that we can maintain the integrity of our bones. So taking it from the top, calcium is the one that you always hear about as the most important mineral for bone health. And that's because, yes, calcium does help maintain the structure of our bones. It helps to regenerate new bone growth. But also, if we're not getting enough calcium from our diet, our body is actually going to pull calcium from our bones in order to keep the level of calcium in our blood the same. So that's why it's really important to make sure that we're getting enough so that we're not pulling it internally and decreasing the stores of calcium in our bones. If you are not eating dairy foods, if you're lactose intolerant or you just don't like them, it's likely that you should be supplementing with calcium. And I want you to remember, with everything that I'm saying here, it's best to first, reach out to me, send me an email, and we can take a look first at your diet to see what you actually might be deficient in versus just guessing. Because I know there are tons of supplements out there that you're being told that you should take, or a friend who's taking them, but remember that everyone is different, and to figure out what's going to work best for you requires diving a little bit deeper into what you're already doing and your intake. So calcium is one of them that you might need. Vitamin D is a second. That's going to help make sure that you are absorbing the calcium properly. And vitamin D deficiency and insufficiency is very common because we are not spending a lot of time outdoors. When we are wearing sunscreen. And just like calcium, vitamin D is found primarily in dairy, fortified foods, mushrooms, salmon, and eggs. And other than that, it's really tough to find. So if you're not eating those foods, you might be, again, vitamin D insufficient or vitamin D deficient, which is an easy fix. A lot of supplements come as sort of a bundle of vitamin D and calcium. But again, remember that you should be supplementing the areas that you need to. That's how you're going to get the most benefit out of your supplementation. So if you're already taking a multivitamin that contains calcium and vitamin D, it might be in your best interest, if we find that you need to just be supplementing those two, that you ditch the multivitamin and you switch to just using calcium and vitamin D. The third thing is magnesium, and magnesium is important not just for bone health, but also in terms of athletic performance. Magnesium is stored in our muscles. So if we are, again, low in magnesium intake, which is primarily coming from beans, legumes, nuts and seeds, and leafy green vegetables, it's possible that our body's going to pull magnesium from our muscles to help regulate our blood levels of magnesium. And when that happens, that can lead to increased cramping. It can lead to muscle twitches. It can even lead to more serious things like cardiac arrhythmias, but it also can really interfere with our sleep. Magnesium is really important to help regulate our neurotransmitters and especially help to provide that relaxation to our muscles so that we're not constantly, feeling these twitches and these cramps and things. So it can really help to make sure that we are getting a restful, complete night's sleep if you are getting enough magnesium in your diet. Again, you don't need to necessarily go starting supplementing with magnesium, but just starting to be aware of if you are getting enough in your diet or if you're experiencing any of those side effects, it might be a good idea, something we can talk about. Send me an email and let me know. But I think that covering your bases of getting those 3 things, starting first with an overall healthy diet that does include calcium from food sources such as dairy products, vitamin D also from dairy products, or alternatively salmon, eggs, mushrooms, and magnesium from legumes, nuts and seeds, and dark leafy greens. Covering all your bases there, making sure that you're feeling good, you're doing everything that you can, staying hydrated, and if you're still experiencing, whether it be increased risk of bone fractures or stress fractures or breaks or sprains, or maybe you're feeling like you're not sleeping well or you're having excess cramping or muscle twitching, then I want you to send me a message so we can talk a little bit further about what you might need to supplement for better bone health. I hope this was helpful, and I will talk to you soon.